morning. Like most of Bermuda, I was shocked by the report on ZBM last night. A report that revealed that for some time now, the Minister of Health, Patricia Gordon-Pamplin, has been misleading Bermudians about the financial performance of the Foggo Urgent Care Center. The facts are laid out in the Strategic Assessment Business Case. The OBA claimed that the Foggo Urgent Care Center was operating at a loss of $250,000 per year. The truth is that the Foggo Urgent Care Center operated at a $104,000 surplus in 2012-2013, and it also had an operating surplus from April to July this year of $95,000. That is correct, and it's a fact. As we have said in the past, Foggo is operating at a profit. So what do we have here? A minister who stands up in Parliament and says that there is a loss of $250,000 per year, while reports from the Bermuda Hospitals Board show that Foggo turned a profit last year and again this year. Either the minister was misled by her board's chairman, Mr. Bruin, or the minister misled Parliament and the country. In either case, someone must be held to account. We must also ask, why would the OBA minister mislead the public on an issue like this? Perhaps it has to do with the word that has gotten a lot of attention lately, privatization. The report makes the case that Foggo could be very profitable if external providers that, quote, would not be bound by the Bermuda Hospitals Board collective bargaining agreements or revenue caps. The minister has admitted to a private, non-transparent meeting with unnamed physicians about taking over the facility, no contract put out to tender, no input from the public, no openness, and no transparency. It all gives the impression that the OBA is more interested in hooking up their friends and family than in protecting access to health care for all the people of the East End and indeed Bermuda. The PLP believes that the people of St. George's, St. David's, and Hamilton Parish are just some of the people who benefit from this wonderful facility and that it must be kept open. That's why we propose dumping the OBA backroom deals, improving efficiency at Foggo, and keeping its doors open. The PLP proposes consolidating government's public health presence in the East End to Foggo, shifting the functions of the St. George's Clinic to the Urgent Care Center, restoring diagnostic services to the Foggo as an additional source of revenue, reducing staffing costs by shifting a greater emphasis on mid-level practitioners and medical assistants, examining the operating hours to ensure they meet the needs of the community, examining the benefits of renting a section of the facility, and last but not least, reduce the Bermuda Hospital Board's executive staff pay by 15%, and this will add $250,000 to the Bermuda Hospital Board's coffers every year. We can work together to keep this facility open. We can work together to improve health care. We can work together to reduce wait times. But we cannot work with a minister and a board that will deliberately mislead the public in a bid to close and privatize this very vital, important center. Foggo is too important to our community to close. The justification that they gave was it was losing money. The report last night revealed that it is not losing money and it is turning a profit. People around the country are calling for the Foggo to remain open. It is my hope that the Minister, Patricia Gordon-Pamplin, the Premier, and indeed all of Cabinet will correct the record in Parliament tomorrow, clarify why she misled Parliament and the country of the financial state of the Foggo Urgent Care Center, and announce that she will be keeping Foggo open to review the options in the report. Anything short of that action should result in her removal from office for misleading the people of this country.
Morning. The OBA threat to the close of the Foggo Urgent Care Center has galvanized the community of St. David's and the East End in particular. And with the petition having garnered over 3,200 votes, it is evident that the people do not support shutting its doors. The leak of the report, which the Shadow Minister, MP De Silva, has spoken to and which was aired last night on the news, shows that there is more going on with the Lamb Foggo Clinic that meets the eye. And this is really sad. The people of St. David's are tired of being ignored and marginalized, but as their representative, I will not stand by while their needs and the needs of all of our neighbors in the East End are pushed aside and their voices ignored. The Lamb Foggo Urgent Care Center benefits the East End and Bermuda. I'd like you to consider this. Demand for the emergency care is rising, and Lamb Foggo plays a key role in reducing the strain on resources and manpower at the King Edward Memorial. A decrease in the King Edward Memorial emergency beds by about 24%, plus the additional 5,000 patients that would be expected to now head to the King Edward with the closing doors of Lamb Foggo, will lead to a significant increase in wait times and in the emergency room. In severe weather or civil emergencies, Lamb Foggo is perfectly positioned to meet the needs of the East End. Lamb Foggo has helped to fill the service gap between the emergency department and the island's general practitioners. Its existence has led to shorter wait times and greater convenience for patients across the island. If the island were to face another major hurricane, the residents of St. David's and St. George's could once again find themselves cut off and isolated from medical care. As this report shared states, Lamb Foggo is strategically placed and well equipped to provide emergency services with a large generator and located well above potential storm rises. It is an excellent facility. The facility could assist in treating minor victims of any aircraft incident at LF Wade, should that happen. And it would relieve pressure, of course, on a King Edward. It can also serve as an outpatient clinic during a major outbreak of any highly contagious disease. Adding all these factors in and combine them with the desire of the people to see Lamb Foggo open and serving their needs, a compelling argument is indeed made to keep it open. Anyone can cut. It doesn't take thought, vision, or any creativity. We cannot allow our current economic crisis to be used as an excuse for rash, risky decisions. Entities such as health, education, and emergency services are clear examples where the human value overrides economics. Would we see all of these closed? As many of them do run at a deficit. So instead, let's use our brains to find a solution. Let's use our vision to see a way forward. And let's use our creativity to find ways to meet the needs of our people. Let's find a way to ensure that Lamb Foggo operates more efficiently and more profitably. Let us cure, not cut.
Has anyone determined the accuracy of it?
The veracity.
Well, I'm hoping that the minister will do that.
Just to follow that, you just sort of issued a number very attractive proposals for that figure. And I guess I'm curious as to, have you given any thought to these type of proposals when you were actually Minister of Health?
Actually, that's a good question, Mr. Webb. Had we won the election in December, those are some of the things that were on the agenda. Foggo was certainly on the agenda, as were many things with the hospital. And I've said many times before in the House, post-election, that I never denied that we didn't have financial challenges at the hospital. That hasn't helped since we've got a new minister that cut $20 million out of the hospital's coffers within 3 months, i.e. the continued care unit, she cut out the $14 million per year on that, and the 1% increase in fee that was legislatively agreed 5 years ago, which amounts to about $6-7 million per year.
Just clarification, please. I know the BHB announced the 250 deficit, so why do you guys keep saying the OBA?
Well, because the minister made a ministerial statement last Friday and actually specifically outlined that. If you were to check Hansard, you'll find her detailed ministerial statement where she outlined that it was losing $250,000 per year. In fact, in that ministerial statement, the minister, I have a copy here if you like, the minister outlined the losses for the years 9, 10, 10, 11, and 11, 12, which amounted to $250,000 per year. What she omitted from a ministerial statement was the fact that there was a profit 12, 13 of $104,000, and for the first 4 months of this year, $95,000. She omitted that from her statement. And if you take those 2 years of profit with the 3 years of loss, you actually have a consolidated loss of about $112,000 per year. Now, had she not closed the diagnostic imaging at Foggo, maybe we would have had a profit of $300,000 or $400,000 this year. Who knows?
November 29th, next week, Friday. To the public, this is an ongoing debacle. When does it stop? I mean, I know that the power is not in the opposition's hands as such, but where do the people win in this?
Well, hopefully the people will win if the minister, the premier, and cabinet reconsider this rash decision that was made, and unfounded, with regard to finances, decision was made. That's what we hope it does. I'm fighting on behalf of the people of not only St. David's and St. George's, but all of Bermuda. I mean, that care center was used not only by the East Enders, but many from up in the central and even the western parishes. So that's what we hope to achieve. I think they really seriously need to reconsider this. We can play politics. We can play politics every week. This is not a game, and the people in St. David's are not happy.
I'm glad you mentioned about politics, because what I'm just wondering, I almost wish the minister, the cabinet, all were here at the same time so I could ask everybody the question. One, is there a danger of this becoming a political football?
I think it already is, Mr. Webb. I think that the decision was made by a minister that's really out of touch. I mean, it's liable, her chairman has given her misinformation. She hasn't read the report. I say it all the time, and she gives me hell for calling her a part-time minister. But this is evidence of someone that's just not on the ball. She hasn't read the report, obviously, because her ministerial statement doesn't contain the correct information. So political football, it might be a political football for them, but it's not for us, and it's not for the people of this country that want that urgent care center open.
Now, have you yourselves actually seen this report, or is it only the media reports that you're responding to right now?
I do have a copy now, yes.
And the author of that report is who?
I don't know, Mr. Webb. Maybe the minister or the chairman could tell us. I mean, the minister herself has stated on Facebook today that the report that was on the news last night was the one that supported the closure. And this is her words on Facebook this morning. She said in her Facebook comment, the report that was shown on the news is the one used to support the closure. That's from the minister herself. So I guess the report is correct.
She has said after the last interview, you and I, Miss Lisa, when you called for that Foggo Bernews was going to be open and the one for what's justifying its closure. The minister said she had no problem with that, but that's been a couple of weeks now. Still, they haven't been made public.
Actually, she did table that on Friday. The 2007 report you're talking about?
Right, because she said the business, because my point is, what are these business cases and all of this if they were made public?
Well, and she says that this was the report where the decision was made. She says it on Facebook this morning. And if that's the case, the report doesn't show that, does it?
Right.
In fact, it's many things in that report that justifies keeping it open. And as I've said before, you know, the report in 2007 indicated that if they had a turnover of 8,000 patients, it would make it viable. Well, as we all know, currently King Edward has about 30 to 34,000 people that go through King Edward Emergency Department per year. Well, if you take 7 of those and direct them to the urgent care center, it makes it viable, based on 250,000 loss. Now, based on the figures that we have in this report, maybe you don't even need that to make it viable. So someone, whether it's the chairman, the board, or the minister, you need to verify the numbers, the correct numbers.